Good evening, welcome to IEA TV, and we're thrilled to be joined tonight by the Right Honourable Norman Lamb, the MP for North Norfolk and the Liberal Democrat Health Spokesman. Norman, in light of the defeat of the Liberal Democrats at the last election...
The destruction of the Liberals.
Well, your words, not mine. But in light of the party moving back into opposition and Tim Farron becoming party leader, would you consider the party to be more liberal or social democratic at this point?
Well, it has both strands within it, and I want to make sure that it remains a liberal party. And I think we're still finding our feet in opposition and finding our direction. But I think there is a strong enough will within the party to ensure that it remains a liberal party, but also recognising that there is a cause of social justice that we will embrace as well.
The Orange Book was obviously a very large part of the liberal strand of the Liberal Democrats. Do you see that the Orange Book still has a place in the party today, or has it been replaced by something new?
Look, I think that lots of the people who contributed to that, I think their views remain very relevant. Obviously, there was controversy around some of the issues covered. I mean, David Laws made the case for an insurance-based system for the NHS, or to replace the NHS. I think he's actually moved on from that, and I don't think the party has any mood at all to go down that route. But I think the sort of strand of argument that we need to ensure that we deliver social justice, but not through the sort of central state, that we try to ensure that there's an enabling state rather than a always doing state. I think that remains absolutely pertinent today.
I'm glad that you brought up the centralised state because, as you know very well, the United Kingdom is probably one of the most centralised countries,
absolutely,
certainly in the Western world. What do you see as being, how do you see the best way of being able to devolve power from central government to local councils, to the national governments in Scotland and Wales?
I mean, it's interesting that the Chancellor has embarked on quite an audacious devolution programme and enters deals with different combined authorities around the country. But fundamentally, this is about devolving the responsibility for running services. It's got nothing to do with where the money is raised. And for me, that's where the power lies. And I think also there's a question of accountability. If you have a mismatch between where the money is raised and where the service is delivered, you don't get really effective accountability. And I think that's part of the problem with Scotland, that the Scottish nationalists are in power, but they don't necessarily have responsibility for the use of public resource, so they can blame everything on Whitehall. So I think there's an incredibly powerful case for devolving the money-raising powers within this country. As you indicated yourself, we are the most centralised of any European country in terms of where money is raised, with the exception of Malta, and they probably have a good justification for it.
Well, in that case, you should definitely think about picking up a copy of the IEA's Federal Britain on the way out, which argues very much the same point. Yeah. But what do you, as a liberal part of the Liberal Democrats, what do you see as the perfect size of the state? As a percentage of GDP, or do you...
Well, I think you can get rather caught up on a percentage. What is principled about a specific number? I'm more interested in ensuring that what the state does, it does in a way that empowers people, rather than crushing them. And so when we're thinking about welfare, we want to be enabling people to get into work. When we're talking about the delivery of any other public service, it's not about old bureaucracies delivering sort of one-size-fits-all services. It's giving power to citizens to determine what their priorities are, whether it's about helping people get back to work, whether it's about managing the budget within the health or care system, and so on. I think there is an awful lot you can do to give real power to people across society. And I suppose that's where I differ from, a Conservative might take a view of a small state and say that it's all up to the individuals. Well, I take the view that there are lots of individuals who actually need a bit of a helping hand to exercise real power and to play a full part in society, and I think that's what the role of the state can be.
One final very quick question. Presumably you would have seen these new plans by NHS England to have pregnancy budgets given directly to expectant mothers. Do you think that's the direction that the NHS should take now, that instead of having money given to people based on diktat, it should instead, people should have a pot of money that they decide, that's publicly funded, but they decide where it should be?
So first of all, you have to recognise that there are some limits to this concept. The idea of emergency care, you having a budget, it doesn't really make sense. But look, I was the minister who introduced the first ever right to have a personal health budget. That applies to people who have NHS continuing care. Interestingly, the system is being very slow at embracing it. Even though it's a legal right, the number of people getting personal health budgets is still incredibly low. But I want to spread this principle. I want to spread it to people with mental ill health so that they can get control of their lives again. People with long-term chronic conditions, but also I think there's a very interesting case around maternity services, which often under the traditional model rather fail people, don't provide the sort of personalised care and support that a pregnant mother might need. So I'm very interested in applying this principle of giving power to people in a whole host of different areas.
Wonderful. Thank you very much, Norman.
Pleasure.